There are multiple tests that we do in patients with breast cancer. And one of the questions that comes up not at all infrequently is a question of what are the indications for PET-CT examination in breast cancer patients. And there are two different sort of times that such testing would be indicated. One is at the time of initial diagnosis, and another is as part of a routine follow-up of patients who are known to be stage 2 or stage 3 originally. And I suppose then also in stage 4 patients, PET-CT could be used as a way of monitoring how they're doing with their treatment for their stage 4 disease. Now I'm going to give you the surgeon's view of this right now, and then I'm going to allow one of my medical oncology colleagues to give you sort of the view that the medical oncologist has, particularly those who are using PET-CT as part of their routine follow-up process. In patients who present with positive lymph nodes at the time of diagnosis, and we generally establish that not only with an ultrasound examination, but we want tissue, so performing an ultrasound-guided core biopsy would be an important way of establishing that the lymph nodes in the axillary region are positive. So that's usually part of the initial workup. The suspicion for that, if not already there, may come out of a breast MRI examination or certainly from the physical examination of the axilla. There are multiple indications for why we would do the biopsy. And if it's positive, my view as a full-time breast surgeon is that a PET-CT is indicated as part of the initial workup. In other words, if we already know somebody is stage 2, then are we concerned that they could be stage 4, which is the value of the PET-CT examination. A lot of the same thing can also be said at the initial diagnosis for patients who are stage 3. Now, in general, stage 3 are larger breast cancers, 5 centimeters in size or greater, and or coupled with several lymph nodes that are positive, and the answer is the same. It's the same for the locally advanced breast cancer patient. And fortunately, rarely do we see true inflammatory breast cancer, but I'm confident that my medical oncology colleagues would say that with an initial diagnosis of inflammatory breast cancer, that a PET-CT examination would be indicated. So hopefully that sort of wraps my views as a breast surgeon about the use of PET-CT examination of the chest, abdomen, and pelvis. I'm involved with that generally on the front end, or occasionally if I have worries or concerns that the patient is progressing their disease and they haven't actually seen their medical oncologist for follow-up. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.